All right, Miss Lukes, how are we doing?
My toe hurts.
Yeah, so I wanted to talk to you about that. We got the results of the blood work as well as the x-ray. Looking at it and looking at the blood work, we don't see any evidence of infection. This looks like a gout flare. What that is inflammation in the joint, typically caused by uric acid crystals, which is why it's hurting and why it's red today. There are a few things, specifically diet, that we talked about. Eating sardines and drinking alcohol can lead to this accumulation and cause the pain and swelling that you're having there, and this is commonly the joint that's involved. The thing we're going to do for you is give you anti-inflammatories. It's called colchicine. I'll write you a prescription for that before you go, and then I'm going to have you follow up with a podiatrist in a few days and make sure things are resolving appropriately. I'm also going to give you some instructions on dietary modifications to help prevent this in the future.
Okay.
Any questions?
I don't think so.
Okay. Give me a few minutes, I'll get things typed up, and hopefully we'll have you out of here shortly.
Okay, thank you.
Yeah.
Yeah, they're discharging me. Yeah, I don't know. He was here like 15 minutes ago. I don't know why nobody's here yet. He said I could go home. No, I'll call you when I'm ready. Okay, bye.
Hey there, Miss Lukes.
Hi.
You ready to go home?
I am.
Okay. So I've got your discharge instructions that Dr. Sinau wrote up for you. Here's your prescription that he told you that we're going to go home with that anti-inflammatory, which is going to hopefully help with the pain in your foot. Okay.
Okay.
The discharge instructions, first thing listed out. Here's the doctor that he told you to go and see. Okay. This is the specialist that you need to make an appointment with him in the next 5 to 7 days.
Okay.
The next page is going to be your basic diagnosis, which is the gout. Kind of gives you a general explanation as to what it is, what causes it. Further down here, it's going to have the dietary restrictions that were discussed with you earlier,
Okay.
and then the medication that we're sending you home with as well.
Okay.
Okay. As far as what you want to do, here's further home care, and then when to get prompt medical attention. And so
Okay.
just look at the list of everything. If it matches up with what's going on, then I would, either contact your primary care physician, the specialist, or call 911 if you feel like it's necessary.
Okay.
Is there anything else I can do for you?
I'd like some more pain meds before I leave.
Okay.
And then I have a couple more questions that I forgot to ask the doctor.
Okay, the doctor came in and talked to you, right?
Yes.
Yeah? Okay. Well, give me a couple minutes, and let me go see if I can run him down, and we'll get him back there in the room, okay?
Okay,
Is
thank
there
you.
anything else I can do for you right now?
I don't think,
All right.
just pain meds.
Okay, I'll be right back, okay?
Thank you.
Hey, Miss Lukes, Nate grabbed me. He said you were still having some pain and had a question or two for me.
Yeah, I'd like to get some pain meds before I leave.
Sure.
And then I just wanted to know if the medicine that you're giving me is going to interact with the medicines that I already take. And then if there's a difference between red wine and white wine.
Sure. So the medicine, this is safe with the medications you're on. That shouldn't be a problem. I'll go find Nate again and we'll get you some medicine before you go. Sorry about that. And as far as wine consumption, it's really any wine. I would encourage you, especially since you've shown that you can have gout flares, to really decrease and maybe just eliminate alcohol consumption altogether.
Okay.
All right?
Okay.
Well, give me a few more minutes. We'll
Okay.
get things together for you, okay?
Thank you.
Yeah.
You know, the doctor came back in, I gotta wait for the nurse to come back in. Yeah, okay, bye.
Okay, Miss Lukes. I got the pain medication that you requested from the doctor.
Okay,
So this should take care of you for the next several hours, but
Okay.
you still need to make sure you go and pick up that prescription because that's
Okay.
what's gonna hold you over for longer at
Okay.
home. Okay.
okay,
And then don't forget to follow up with that doctor. Okay.
okay,
You have any other questions before you get out of here?
no,
Okay. You're good to go then. Okay.
alright, thank you.
All right. Take care.